Welcome back. Great to have you on the podcast again.
Thank you so much for having me.
You and I were just talking. You were like almost 300 episodes ago. So it's crazy that we get to have you back on now and to hear how things are going. Before we do that, would love for you to tell our audience a little bit about the company if for some reason this is the first time they're hearing about Incredible Health.
Jared, thank you so much for having me here today. So I'm the CEO and co-founder of Incredible Health. My name is Iman Abuzeid. I'm an MD by background. I've been in software for the last 10 years of my career and founded Incredible Health about 7 years ago. Incredible Health is the largest career marketplace for healthcare workers in the U.S. today. Our vision and mission is to help healthcare professionals live better lives and help them find and do their best work. Today, hospitals, health systems use our software to hire nurses in permanent roles, ideally in less than 20 days. And we were also the first career marketplace in healthcare to implement AI recently as well. We're excited to keep growing here. We've grown to over 1 million US nurses on the platform, and over 1,500 US hospitals use the Incredible Health marketplace now. So there's been a lot of growth in the last few years since the last time I was on the podcast.
This is the only time I'll make this joke, but that's incredible. I'm sure you hear that quite a bit. Congratulations. So talk us through the evolution of really from when you started the company to now. What over that period of time, like what new features were implemented and really what stood out to obviously you said you implemented AI. Like at what point did you realize that was something that needed to happen?
Yeah. So look, all of this starts with the problems that we were tackling in our market. The US population is aging and it's growing. That's putting more and more demand on the US healthcare system. And so we as a country have not done a great job of increasing the number of healthcare workers to keep up with that demand. And so as a result, healthcare has some of the biggest labor shortages in the country. The reason that matters for the hospitals and health systems we work with is that they are trying to grow and expand to keep up with the patient demand that keeps growing. They also are managing businesses that are relatively low margin, and so they need to keep, reducing costs, keep increasing revenue. And so all of that workforce is one of their biggest costs. And so that's why this is such a high priority challenge for the health system leaders that we work with. Similarly, on the healthcare worker side, when you speak with nurses, they say things like, I'm experienced, I'm qualified, I apply to 10 places. I usually don't even hear back, right? So they're not having a great time in their job search experience either. And so we really just strongly believe that we can use technology, we can use software to make sure that we maximize opportunities and we democratize opportunities for healthcare workers, and that we help hospitals and health systems reduce costs, drive their growth and expansion, and make sure that they have the staff they need to deliver on an awesome patient care.
I'd love to hear your thoughts on really how health systems have reached a turning point in their financial health, and what strategies are you seeing them use to remain stable while gearing for that growth to meet the rising patient demands?
Great. So when we look back at 2024, it was actually quite a good year for health system financials. But as they think, as health systems as the overall U.S. healthcare system thinks about the next 5 to 10 years, there's some key areas that we all have to focus on. Number one is on supporting the growth and expansion of our health system. Because the patient population is growing and aging, we have to make sure that we can support the growth and expansion into new areas. The second is paying attention to costs. So hospitals and health systems do whatever they can to keep reducing the use of temporary labor. Temporary labor is usually about 2 to 3 times more expensive than their permanent labor, which eats into their margins. So they have to keep focusing on that. And then they also have to focus on areas that are driving revenue, right? So for example, surgical services, the operating rooms are critical areas that they have to keep growing and make sure that it remains well staffed as well. And so what's happening with the healthcare workforce, the recruitment of it, the retention of it is top of mind for health system leaders.
Now, as we're in 2025 now, like I would love to hear a lot of hospitals are heavily focused on expansion projects. So, how do they balance this growth while still addressing these skyrocketing labor costs, especially in the high demand roles like ICU and med surg nursing?
So they're in a really tough position, right? And that, I mean, what you just asked is like the crux of the problem. Like, how are they going to pull that off? Now, one of the that this is sort of one of the reasons that Incredible Health continues to grow, right? So, um, we when we looked at this market, we realized that the way hospitals and health systems hire, the technology, the tools, the processes, not a whole lot has changed in over 20 years. It's like post a job and hope it all works out, right? And that's really, it doesn't necessarily work out, especially in areas that are high priority areas where there isn't enough staff. And so they're using our marketplace because it differentiates them in a few different ways. Number one, the employers apply to the nurses instead of the other way around, right? And because they're the ones who are more demand. As you can imagine, the nurses absolutely love that. We've also automated the screening and automated the matching. So it's a highly curated or personalized experience for both the recruiters at the hospitals as well as for the nurses. We've also found a way to engage nurses in a consistent way. So we provide a whole range of free tools and services to nurses in our apps, including continuing education, salary estimators, a community where they can ask each other for advice. And so that helps us acquire such a huge network of nurses and keep them engaged on the platform as well. And so all of that's been pretty important to making sure that we can transform and change how hiring happens today.
Now, you mentioned earlier in two spots, right, how you implemented AI. So I would love to hear more on that piece, especially. It's not a podcast today if you don't mention AI a couple times, right? So how AI is playing a key role in speeding up that recruitment process, and then, um, what impact on some of the hiring processes that you mentioned, like what impact is it having on these critical hiring processes?
Yeah, so we're big believers in generative AI and are investing heavily in that technology. So at the end of 2023, we became the first healthcare career marketplace to use generative AI in the marketplace. So specifically, we use it to expand opportunities for healthcare workers, as well as just make hiring even more efficient. So specifically, we added a feature called the Resume Wizard. So it turns out that 30% of nurses start their job search without a high quality resume. And that's for a variety of reasons. Sometimes it's a awareness and education challenge. Sometimes it's a socioeconomic challenge. They may not have laptops like you and I. And so in the Incredible Health mobile app, they can now generate a resume using Gen AI that's high quality and meets the requirements and needs of an employer. And so that way they're not locked out of the job search experience. So we've brought 30% of the U.S. nurse workforce into the job search process by making sure that they have high quality resumes that are going to work well with employers. The other important feature for us is a customized health system outreach that we do. So I mentioned our claim to fame is that the employers apply to the nurses instead of the other way around. We now use generative AI in that messaging too, and it's now highly personalized, highly automated. And what we're doing there is we're highlighting the unique attributes and perks of a health system to help them differentiate and stand out from their competition. And that has led to a 20% increase in nurses accepting interview requests. And so we've been able to roll this out across the country, and it's had tremendous impact. And our health systems love it because it really helps them differentiate and look and stand out from their competition.
Now, when you think about new features beyond what you've already released, to like what goes in that thought process before something gets added to roadmap, like through your lens and your team?
Honestly, it always starts with the problem. What are the problems you are trying to solve for our customers? And this is one of our number one values at Incredible Health is customer obsession. Like, do whatever you can to delight your users. And so we have to have a really clear understanding of what the challenges are that we're trying to tackle, and then based on that, we sort of shape potential. We have a hypothesis, and we come up with potential solutions. More recently, so for example, recently we launched two features using this approach. So I mentioned earlier how much health system leaders are really focusing in on priority roles and priority areas that are driving their growth and expansion. So it could be certain geographies, or it could be certain specialties, like we talked about the OR, the ICU, the ED, that's important for expansion as well and for driving more revenue. And so we created a feature called Spotlight Jobs, right? And what Spotlight Jobs is, what it does is it aligns what the health system leaders want with what their recruiting teams need to focus on and in our platform. And so Spotlight Jobs helps recruiters really identify what are the most important jobs to focus on and what are the most important candidates to focus on. And then it's a similar experience on the healthcare worker side. The results of Spotlight Jobs is that those that are nurses that are going through that feature and that path are hired at 76% faster. And so really just focusing in on what are the strategic problems and then building features that fit that. Another example of this is our Direct Connect feature, right? So we know that the traditional application process outside of Incredible Health is lengthy. It's frustrating. Nurses have to wait. Sometimes they don't even hear back. And so Direct Connect really helps empower nurses to take control of their job search and target roles that are matching their skills and their interests. And so with Direct Connect, a nurse is able to skip the line and get it to the front of the queue, basically, in front of with employers, and make sure that they can just get interviews as quickly as possible. And nurses that use the Direct Connect feature are 8 times more likely to accept job offers, which makes it such a powerful career advancement tool for them.
When you look at the rest of 2025, what key things are you really looking out for? This could be trends, data that'll be coming out. Is there anything that's really top of mind that will impact your decision making this year?
Yeah, so 2025 is going to continue to be a growth and expansion year for us. We have some important announcements coming up in February, actually, where we're going to be sharing more about how we're expanding beyond nurses. And we're expanding into technicians, for example, and then we're also expanding to other care settings. Our bread and butter has been acute care hospitals, but in the last 12 months, we've expanded to surgical centers, to home health. There are many other types of healthcare employers that this marketplace needs to support, and so we'll be expanding into those areas too. Probably more broadly, though, what we're really focused to keeping an eye on is how we sort of treat and support the healthcare workforce. There's some key issues that are still there and haven't been tackled yet. I'll mention a couple of them. One is workplace violence. We've seen a doubling of patients or patients' families verbally or physically assaulting nurses at work. And that's been a really uncomfortable trend that's happened, and a really dangerous trend. And so where we've put together a healthcare policy navigator that helps nurses as well as health system leaders, tackle important issues like that. So for example, some of the solutions that we know that are already in the works are, hiring police instead of just regular security at hospitals. Or there are also a lot of pressure on both local policymakers as well as state and federal policymakers on implementing more zero harassment policies when it comes to workplace violence and assaulting our workforce, right? The healthcare workforce. So there's definitely going to be quite a lot more work to be done there to make sure that we don't burn out this workforce and that they're treated well, and because it's such a critical workforce to the U.S. that we need to take care of and grow and expand.
I love it. If you had to, I remember how excited you were talking about this several years ago. That light is still there. What continues to drive you in building this company and having fun while doing it?
I mean, ultimately, it comes down to our vision and mission, right? It's to help healthcare professionals live better lives and help them find and do their best work. That's our North Star. That's ultimately what we're trying to do here. And it's just been so fun to work on it with our health system partners, with the nurses on the platform, and then, of course, with the Incredible Health team. And we're just really laser focused on continuing to drive that mission forward. And it does mean that we have to expand to other types of healthcare workers. It means we have to expand to other types of healthcare employers in order to and continue to improve our product and our services in order to make sure that we can fulfill that vision and mission. So that's really what's keeping me going. I am particularly excited by newer technologies, and we've always been big believers in machine learning and in generative AI as well. And so we'll continue to be sort of implementing those features in ways that help our users. And then also, like, we've also implemented generative AI internally, right? Just even for our own business processes. For example, when a nurse creates a profile on Incredible Health, and uploads a resume, we are using generative AI to process a lot of those skills and specialties and so on. And so we're just interested to see how our own workflows change in the coming years too.
I love it. Well, I want to thank you once again for rejoining us for a second time on the show. Lovely having you. Hopefully, we can have you on a third time. We can dig even more. But really appreciate you being here today. So excited to hear about all the progress and the AI implementation. I'm wishing you the best of luck.
Thank you so much for having me, Jared. It was great to be here.